Tips for stress incontinence, specifically stress incontinence that's coming from pressure above the bladder. So that's going to include when we cough, when we sneeze, when we laugh, when we vomit, when we gag, when we kind of are choking on something, when we're clearing our throat, when we're blowing our nose. All of those are things that for some of my patients, and probably some of you, have caused or do cause urine to come out. In most cases, what that's doing is causing a pressure above the bladder, so a pressure in our abdomen, because all of those are forceful exhales, right? When we cough, when we sneeze, when we are forcing air through our nose to blow our nose, when we're vomiting, all of those are pushing contents, mostly air, but in the case of vomit, obviously, other things. But really what it's doing, it's creating a pressure, and ideally that pressure is driving pressure up and out to really clear the airway, okay? When we are not managing that pressure well, it's going to drive some pressure down into the pelvis as well. There's always going to be a little bit of pressure in the pelvis increase, but we don't want it to be too much, and we don't want it to overpower the urethral sphincter, okay? So let's break that down a little more at the kind of organ level here. So this, again, is going to be our bladder wall, and this is the urethra, okay? Around the urethra, we have the urethral sphincter. So the wall of the urethra is a circular muscle that's closed when we are not going pee. So that's pretty much all the time unless we're actively trying to go pee, okay? What happens in the case of stress incontinence is pressure comes down, and this should increase and the lift should happen, but if it gets overpowered, then the sphincter, this little circular muscle, it gets pushed open, okay? And that's why we have little spurts of urine. It's not a lot. Sometimes it's a drop or two, sometimes it's a little spurt, but it goes away as soon as that pressure is done. So think I sneezed, achoo, it's a very short thing, I'm done sneezing. During the maximum pressure, pee comes out, and then the sphincter, it never relaxed, it just got pushed open. And so what happens when we're done sneezing is that sphincter is still closed and pee is staying in, we're not leaking anymore. Now, if we sneeze a bunch of times in a row, it might cause leak, 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 or if we cough a bunch of times in a row, that sort of thing, okay? In some cases, yes, a big pressure might cause the bladder wall to actually contract and just push the contents out. That is going to be a pressure-induced kind of contraction of the bladder. That's not most people's stress incontinence, although that can happen. That's going to be the really large volumes of leakage. Either way, we're still trying to manage the pressure, okay? So now that we understand what's going on, we want to look at what we can do about it. Okay, so our goal, actually let's keep that for just a second. Our entire goal with stress incontinence is going to be that we keep this pressure from getting increased beyond what that muscle can do. So we don't want it to really increase a lot, because this muscle, honestly, not that strong, okay? And the biggest way that we're gonna do that, it's not going to be squeezing this, because this urethral wall, guess what? We don't have voluntary control over it. And so we have to then use our pelvic floor muscles, okay? And so when we feel a sneeze coming on, we're gonna squeeze and lift our pelvic floor, achoo, okay? But that's not all. That's, most people refer to that as the Knack in the pelvic floor community. That's great, squeeze before you sneeze, it's catchy, it rhymes, it helps you remember. We have to train it that way, okay? And we have to look at the whole system, okay? So it's not enough to just be able to know where your pelvic floor is, how to squeeze it, how to lift it. We have to train it with an exhale, because if we go back to cough, sneeze, laugh, lift, not lift, we're gonna get into lift in a second, although that does and can increase pressure too. Vomiting, blowing the nose, all of those things that are gonna increase the upper kind of belly pressure above the bladder, all of those things are exhales. When do we need that support to come on? With those exhales, okay? So how are we gonna train it? First, we have to find that lift, okay? So we wanna think about, some people will use the cue of, like, imagine your labia, you're gonna squeeze like a blueberry or something like that, and then you're gonna try and pull it up into your body. Another cue is thinking about your pubic bone and your tailbone, kind of pulling those together, or your sit bones, pulling those together. Any of those cues work, that's fine. Once you can find that muscle, you know how to contract it, the next step is do it with an exhale, okay? So you would take a breath in, let everything expand, including your belly. Everything expands, then you squeeze, and as you're exhaling, you're lifting up into your body, okay? Now, if it's hard to find your pelvic floor, guess what? Your belly muscles should be working along with this, okay? So you can look at your abdomen here, and if your belly is coming, if you're able to get your belly to come in, so think I'm gonna breathe in and everything expands. I don't know how well you can see that in the video. And then as I exhale, I'm pulling my belly in. Okay, now the big caveat, and we're gonna get into making sure we're contracting our belly correctly, but if you have your hand on your lower belly specifically, that's where we want to pull in most, okay? Because if you pull in your upper abs, that's going to look like this. And I'm still doing that with my exhale, and I'm pulling my lower abs or my upper abs in, but watch my lower belly. It's pushing out. Remember, my bladder sits right behind that. That's not going to be helpful for our pressure. So if I'm coughing and I go or achoo, and I have this outward push in my belly, that is not what we want. That is going to challenge that pressure system still. Instead, let's think about, take that breath in, expand, and then lower belly pulls in. That way when I cough and I sneeze, achoo, I can feel that movement inward, okay? So that's gonna be the coordination for stress incontinence from the muscle standpoint, okay? Now, one last thing, I hope you're staying with me here because this is super important. One last thing is going to be reminding ourselves that the bladder, if our pelvis is upright, the bladder sits, let's go from this direction actually, the bladder sits on our pubic bone if our pelvis is upright, okay? Why is that important? Bone does not get tired, okay? So if we can position our pelvis in this upright position when we're coughing, sneezing, vomiting, doing all the whatever big pressures it's gonna be, then we can make the muscles have a lot less load on them, okay? Meaning they don't have to work as hard. If they don't have to work as hard, then it's going to be easier for them. They won't fatigue as fast, and we're gonna be a lot more likely to be able to support bigger pressures, okay? So what does that look like? I'm gonna turn sideways. Our upright pelvis is gonna be rocked up. I think we can see me, but let's go forward just a little bit. Our upright pelvis, again, we're gonna think our pubic bone here, our tailbone, we're gonna think lifting our tailbone, rocking our pubic bone down. So from our model view, that's this, okay? And when we cough, sneeze, achoo, okay? We're in that forward position. Second thing, our ribs, all the lower ribs right here, we can feel they go all the way up. We do not want our ribs to drop down. If our ribs are dropping down, guess what I'm doing? I'm smashing my belly. And at the bottom of my belly, remember, is bladder, okay? If I am smashing into the bladder, I'm adding more pressure. And the more pressure we have, the more likely it's going to be that our pelvic floor muscles are gonna give under that pressure. They're gonna let that sphincter come open, okay? So again, the two best recommendations that I can give you to stop pressure leakage is going to be train the pelvic floor muscles how we need it to show up. So that's going to be that contraction, that lift as we exhale, okay? Second thing is going to be watch your posture, okay? So many of my patients, and probably you guys too, have the habit of achoo or and they really round into those things and they just drive that pressure up and they take away that support. All right, I really hope those tips help you. If they don't and you're not sure what's going on here, please try and find a pelvic floor physical therapist that can give you more specific cues for your body.